You should give me a count of 3, why then I'll go.
Sure, ma'am. Give me 10 seconds. We are good to go.
Yeah. Can I start?
Yes.
Yeah, thank you. Good evening, everyone. It gives me immense pleasure to welcome you all to this edition of Fever Foundation Quiz. Today we are having the North Zone quiz competition. And before we go to the actual quiz itself, I would like to very briefly tell you about Fever Foundation, which is who is organizing this Fever quiz competition. Fever Foundation is an independent and non-commercial foundation supporting the educational and academic activities to address the unmet needs in fever management. The foundation is committed to conceive, build, and sustain program and to make initiatives which are aimed at providing evidence-based update to healthcare professionals. With regard to the vision of Fever Foundation, it is to strive towards imparting knowledge on the unmet needs and provide information on research, education, and therapy updates on fever management. The activities of Fever Foundation includes annual fever conferences, fever CMEs. We bring about a book on fever management. Clinical and epidemiological research happens. We have started this year first research, challenging case presentation competition, young scholar award, patient education, paramedical education, public awareness, and parent education activities. So this year we had some special initiative. We started celebrating Fever Week from 24th to 30th May. It's the first time in India and first time in the world Fever Week was conducted. It was to commemorate the birth anniversary of Sir Gabriel Fahrenheit, who invented thermometer and the Fahrenheit scale. So during this week, we had several scientific activity. We had a mega webinar, national panel discussion on 24th May for pediatrician. It was on the topic errors in the management of fever. Then 25th May, we had for physician. Then we conducted CME across India. We planned more than 100 PME, CME programs in that week, and we could conduct all those CMEs across India. And during the fever week, we also had a lot of patient education and public awareness activity. I thank our Fever Foundation advisory board members helping us through this. And they, in fact, conducted this, and they were there on the FM radio and giving in the regional languages the patients and the public education activity myths, facts, do's, and don'ts during fever. Thanks to them. Then we also started fever research activity initiation. First original research activity has been initiated at Ellen Medical College, Bhopal. And we have postgraduate quiz competition. We have been conducting it for the past 6 years, and this year the zonal quiz is going on. Today is the last day for zonal quiz. We started on 23rd, 24th, 25th, and 26th. Today is North Zone competition. So pediatric PG quiz we have at 4 o'clock, and the internal medicine postgraduate quiz always every day at 7 p.m. And we do have a poster presentation competition for PGs, pediatric and internal medicine. Please note, last date of submitting your posters are 10th September, and the poster presentation competition will be on 17th and 18th. Please note the topic has to be related to fever. It can be case report or it can be original research, but to be related on the fever only. Then we have developed fever training manual. We are planning a certificate course for general practitioner and the family physician on the various aspects of fever management. I take this opportunity to welcome you all to FIFCON 2024, which is our seventh national conference on fever management, which is called, it's a conference of Fever Foundation of India, which is called FIFCON, and it's going to be held on 23rd and 24th of November. I request all of you to register and join this program. So you will have fantastic scientific session, very eminent speakers will be there, where across the specialty people will come under one roof, both pediatrician, physician, infectious disease specialist, critical care specialist, epidemiologist, pharmacologist, then microbiologist, pathologist. All those specialties who manage fever will come under one roof and discuss about the various aspects of the fever management. Please do join in. The link will be sent through your email IDs, and also all the details of the conference and the agenda will be sent to your department, will be displayed on your notice board. That's a free registration, so it's conference. So next, coming on to today's quiz program, I once again welcome to all of you. I just would like to introduce our quiz panelist. Our quiz host is Dr. Jagdish Shenappa sir. Sir is a consultant cluster head at Pediatrics in the Manipal Hospital Group at Bangalore. Sir is a past president, respiratory chapter, Indian Academy of Pediatrics, 19 and 21. Sir is also CEO of Bangalore Medtrain LLP. He is a consultant, Child Central Bangalore. So, Dr. Jagdish Channappa, sir, it's really pleasure and privilege to welcome you, and I really thank you for helping us conducting this quiz throughout for the past several years, including this year. Thank you so much, sir. Welcome to you. We have a quiz master today, Dr. Balivant Anandakrishnan sir. Sir is a consultant pediatrics at Manipal Hospital, Bangalore. Sir is member of IAP Pediatric Infectious Disease Chapter, member of European Society of Pediatric Infectious Disease. He has done certificate course in HIV and other congenital infections from Italy. He has also done a certification in Visor Immunizer Management Core ESPID, certificate in antibiotic management course again at ESPID, and fellowship in infectious diseases from UK. And he has published in various peer-reviewed medical journal, and he's been there for various CME speakers. And he has also helped last year. Also, he helped us quiz program. Today, also, I really thank you for accepting and coming as a quiz master. So, welcome to you, sir.
Thank you, madam. Thank you.
And we have Dr. Rachna Das, madam. We will be hosting with Dr. Balivan, sir. Madam is a professor of pediatrics at PA Sangma International Medical College Hospital at Meghalaya, and also Rikpa Children's Clinic, Guwahati. She is associated consultant Sydney Child Health Program, University of Sydney, Australia, fellow of pediatric infectious disease MCM. MS and examiner at IGNO, and formerly she was also associated and the founder head of pediatrics and the controller of examination at NEIGR HMS at Shillong and Meghalaya. So madam has several accolades and several kind of achievements. Just a short of time, I'm just reviewing is it. Her area of interest is pediatric intensive care and pediatric infectious disease and respiratory disease and pediatric rheumatology. And she has been really been awarded with several awards and accolades both from the government and NGOs and others. She has more than 50 publications in various national, international, and the regional journals. And she's been the editor of various newsletters of IAP, chairperson of scientific committee, and also editor of Pediatric Info. And she is a Clean Air Champion, Doctor of Clean Air, Lung Care Foundation, and member of Task Force of Government of India on COVID-19 Preparedness for Children. And she's been the founder member of Fever Foundation. Madam is also helping us with various scientific activity of Fever Foundation. I welcome Madam to this program. Thank you very much, ma'am. Welcome to you. So before we go, I want to introduce the most important member is the quiz jury. Sir is the jury for us for all the quiz programs. Sir will be ensuring that all the fairness and everything happens as per the rules and regulation, which is none other than the Professor Dr. M.K. Sudarshan, sir. Sir is also founder member of Advisory Board of Fever Foundation. Sir, ex-director on retired dean and principal, professor and HOD of Community Medicine at Kempegowda Institute of Medical Sciences, Bangalore. Sir, the chairman of State COVID-19 Technical Advisory Committee, Government of Karnataka from March 20th to September 23. Chairman of WHO, Southeast Asia for Rabies Technical Committee. He has also been a member of National Technical Advisory Group of Rabies of Government of India and NAPH, Principal Assessor of Ethics Committee and Clinical Trials.
You may please cut short, madam. Thank you.
Yeah, thank you.
Thank you.
Sir has
Thank
been
you.
really
Thank you.
with us, and you can see a lot of awards and accolades. And he's been the Best Doctor Award, BC Rai Award, and honorary doctorate. Sir, it's welcome and pleasure to have you, and thank you very much for helping us to
Thank
conduct
you.
this
Thank
program. Thank you, sir. Before we start the quiz program, I would like to tell about the rules and regulations of the quiz. The quiz is for postgraduate students only. The quiz consists of a multiple choice questionnaire and 15 seconds to answer each question. The option to be selected by clicking on the button on the text panel. The video display with option will be only for representation purpose only. The participants are advised not to leave the platform. Once the answer is submitted, it will not be possible to revert, and no negative marking. and the winner will be the maximum fast right answer. If there is a tie, the tiebreaker round will be done to decide the winner. I just want to repeat 2 points again here. The option you should select by clicking on the button on the text panel. The video what you are seeing is only just a representation. You cannot click on the video. You will have the text option just below the video wherein you need to click the button to submit the answer. Only those will be recorded. So please ensure that you click on the text button and submit your answer. And it's advisable to use laptop and desktop. Should not use mobile phone for getting answers for any colleagues are sitting nearby. Fever Foundation is not responsible for any form of technical error. Participation in the quiz implies that the participant accept the integrity of these rules. The participants who have given incomplete or inaccurate personal or contact details will be disqualified. Non-compliance with the rules results in automatic cancellation of the participant in quiz and the candidacy for prize. The first and the second winners from each zone will enter national level quiz competition, which is scheduled in November. And finally, the quiz master and the judge's decision will be final, and we all have to abide by the rules. So, thank you very much for listening. I wish you all of you a best of luck and happy gaming and learning also. Our eminent doctors would be there to help you out of that. Thank you very much. Over to Dr. Jagdish sir as a co-host. Over to you, sir.
Thank you, Dr. Manjula, and it's always a pleasure to be here. And Dr. Balivant, my quizmaster, is here today. Dr. Rashna will be joining in a few minutes. Dr. Sudarshan is here to look at whether we conduct this quiz properly or not. Thank you, Mr. Jairaj and Mr. Praveen Singh for also being there today. So anyway, the rules of the game have already been outlined by Dr. Manjula. Please note two things. You have to choose the correct answer and you have to choose it fast. And you have to choose it correctly. Basically, many of you may get the correct answers correct, but the person who hits it the fastest will be rewarded. And these questions are not very difficult. They're pretty easy for postgraduates, so don't worry about it. Please participate enthusiastically and make it fun. So let's start. Computer Ji, are you ready? Shall we start? Okay, to start with, we are going to give some dummy questions. These are questions to get you used to the platform. After the first 3 dummy questions, we'll get on to the main show. So there are no marks for the dummy questions. It's only for you to get acclimatized to the system. So can we start off, Computer Ji, with the first question? Yeah, we can. This has already been outlined. Go ahead with the question, please. Which is the fastest land animal? Is it a lion, an elephant, a cheetah, or a deer? You can start now. You will be given 15 seconds, but I'm sure most of you should answer within the first second. Well, you can highlight the answer, please. Yes, it is the cheetah. The spelling is a bit wrong, but it doesn't matter. It is the cheetah, which is the fastest land animal. And it can outrun all the others on top. The elephant is the slowest. The deer and the lion follow, and then subsequently the cheetah. Right? So let's see how many have answered correctly. You can put in the graph, please.
Yeah, is the graph ready? So these are the dummy questions. So you please practice so that it will be easy for final ones. Yes, sir. The graph is ready.
Yes. So I think everybody's got the answer correct. And so we have a very, very intelligent and fast audience. Let us see who has answered first. Well, Dr. Acharya has answered from GTB Hospital, New Delhi. And she has taken 2 seconds. That's wonderful. So let's move to the second demo question. Complete the line, twinkle, twinkle, little Is it star, sun, moon, or planet? Dr. Manjula, I think we should get about 100% here.
Yes, sir.
Being
Your
being pediatric.
time starts now, sir. It's
Yeah,
okay. Yes, sir.
yeah,
Over. Time is getting over. Yeah.
yeah, being pediatric
They have to.
practitioner. Yes.
Sir, even now we remember, sir, this song, this poem, this
Let's see.
rhyme actually.
Let's see the graph.
Dr. Vasudev has joined.
Wonderful. So he wants to see how his zone does, sir.
I think sir is traveling. I think Dr. Vasudev sir, are you? I think he said he will be traveling. Yes, sir. Welcome, sir.
I'm on way to airport.
Ah,
I have joined since beginning. I've been listening and hearing all the comments. I've been there since beginning. So I'm on in the car, so it's not difficult.
okay, right.
So
Thank you.
Manjula madam and
100% right now, sir.
100% correct.
Ah,
So good. So let's see who's done it. Who answered first and fastest? Well,
Okay.
again we have Revant Kumar from the same college, isn't it? Yes. Okay.
Yes, sir.
New Delhi. Wonderful. And he has taken this time 1 second. See, all of you are getting better at it. The first person took 2 seconds, you're taking 1 second. So I think it's excellent. Let's get to the third demo and last demo question. Which is the national sport of India? Is it cricket, football, hockey, or kabaddi? So this is a little tough question. So let's see. Time starts now. Well, highlight the correct answer, please. Well, it is hockey. And another very unique day today is the start of the Parisian Olympics. So I think India should do well there. So we should do well in hockey. Let's see the graph, please. How many have answered correctly? Do you expect 100%, Dr. Sudarshan here?
No, I don't expect. Certainly not.
Okay. So
That too with cricket being there. I'll be pleasantly surprised to see a 100% correct answer.
Right,
I'll
sir,
be
right,
happy.
Well, sir.
Great.
Oh, sir.
So let us see who answered fastest now. I think this will be 1 second again. Manjula?
Yes, sir. Yes, sir.
Yes, 1 second. Again, Revant
Same
Kumar from
Revant.
University College.
Yeah,
Well,
SMS.
wonderful. So now we've finished the fun part of it. Now we get to the serious business. So you have got the hang of it. So let's start with the actual quiz. And I will be taking the first 3 questions and Dr. Balivant will continue after that. So let's start with question number 1. Penton Valentine leukocidin is produced by A. Streptococcus, B. Staphylococcus aureus, C. Pneumococcus, and D. Corynebacterium diphtheria. Your time starts now. Well, what is the correct answer, Computer G? Yes, the correct answer is Staphylococcus aureus. Penton Valentine leukocidin is produced both by MRSA and MSSA. It is a very interesting toxin because it inactivates the leukocytes, and therefore, if you find a low leukocyte count in a child who's got Staphylococcus sepsis, you must always suspect Panton Valentine leukocidin, or PVL toxin. When there is a toxin, you need to give an antitoxin medication also in addition to an antibiotic. And the antitoxin medications are two antitoxin antibiotics. One is clindamycin, the other is linezolid. So both these can be used to counter this toxin. So let's get the graph now, if it is ready. Computer ji, the graph, we are waiting for the graph.
So, is the graph ready?
Yes.
Right. Yeah, it's coming.
So we have a hung house. We have all four organisms being outlined, but the vast majority have answered it correctly as Staphylococcus. So let's see who has answered fastest. Wonderful. Dr. Bhavya Shah has answered in 1 second from the Maharaja Suhail Dev Medical College at Uttar Pradesh. Congratulations. So let's get to the second question. Which of the following helps to differentiate a drug rash from typical measles? A, the patient has enlarged tender lymph nodes. B, cephalocaudal progression is absent. C, a drug rash seldom occurs in children more than 3 years. D, a drug rash does not resemble measles. And your time starts now. Thank you. Can we have the correct answer, please? Absolutely. Patient can have enlarged tender lymph nodes in a drug rash. Patients can get drug rash even in small children. And a drug rash may resemble measles in many ways because it is a maculopapular rash. You can get a hemorrhagic rash. You can get different kinds of rashes. You can have an exfoliation. You can have a Steven-Johnson syndrome with a drug rash. But what is peculiar about measles is it starts from behind the ear and progresses across the body right up to the extremities. You also may get an enanthema, that is, you may have a rash inside the mouth or what is called as the Koplik spots. So it's important that when you're looking in a child who's got fever and rash, you look carefully inside the mouth for Koplik spots and you look for progression as it starts from the back of the ear or the back of the pinna downwards to the extremities. So this is a very characteristic issue of typical measles. Of course, many of our children are now vaccinated and may not show this characteristic progression. So let's see what the graph says. How many of you have got that answer correct? Well, again, I'm very, very, very happy that the vast majority have got it correct. So now let's see who has got it fastest. Sonu Prajapat. Well, wonderful from SN Medical College, Rajasthan. So 2 seconds. Excellent. Well done. So now we have Uttar Pradesh and Rajasthan, both of them participating or getting into the race quick. So let's take question number 3. Question number 3 is which bacterial infection known for causing fever and characteristic bullseye rash and transmitted by ticks? Your time starts now. You have tularemia, Lyme disease, Q fever, brucellosis. Correct answer, please. The answer is Lyme disease. I'm going to bring in Dr. Balivant because he's a person who's trained in the in UK. How often have you seen Lyme disease, Dr. Balivant?
Sir, in India, Lyme disease is rare, but in the western side, the Lyme disease is very common. It's caused by a tick bite. Generally, children presents with rashes. The rashes, characteristics rash, looks like a bullseye appearance. The bitten area, there will be a erythema, looks like a small nodule. Then the rashes start spreading. Looks like a very big oval rash. Suddenly, there will be a central clearance. So the peripheral rim looks like a one erythematous zone followed by a central clearance. Then again in the center there is a nodule. So this looks like a bullseye appearance. This is a characteristic of Lyme disease rash.
In addition to the skin manifestations, Lyme disease particularly will affect the joints, and you might land up with an arthropathy which can remain for many, many years. So I think it's important to recognize this disease. It's not so prevalent in our country, but is pretty common in especially the United States. So if a child comes in from the United States with a peculiar rash, please keep Lyme disease in mind. So let's see the graph now. Okay. So we have quite a few who have answered it correctly. So let us now see who has answered it fastest. Again, we have Revant Kumar, who has now come back into the game from New Delhi. So now we have got a good spread from Rajasthan, from Uttar Pradesh, and from New Delhi. So now Dr. Balivant will be your quiz master. I hand over the question number 4 to Dr. Balivant.
I also welcome Dr. Rachna ma'am. She has just joined in, sir.
Welcome, ma'am.
Yeah, good afternoon. Just for some time. I might have to leave anytime.
So then we will do one thing. Dr. Rachna, you start the quiz till as long as you are there, and Balivant will take over after that.
No, sir. It's okay. I think Valivant is doing a good job.
Okay, fine.
I'm sitting in between a lot of people. Yeah.
Okay. Balivant, you can start.
Yeah. Question number 4. Blueberry muffin rash are seen in A. Congenital syphilis, B. Rubella, C. Measles, D. None of the above. Your time starts now. Answer, please. Yes, rubella is the right answer. Blueberry muffin rashes generally occur in rubella-like infection, and also it is a very characteristics of congenital rubella. But very rarely congenital syphilis also we may see this type of rashes. But the measles definitely will not produce any blueberry muffin rash. So since none of the above will not come, and measles also not in the choice. So rubella is the most common disease which can produce the blueberry muffin rash. This blueberry muffin rash, generally if you see a kind of skin deposits of blood producing cells like extramedullary erythropoiesis, or sometimes some purpuric rashes. Very rarely some cutaneous leukemia like conditions can produce a metastasis also. Computer G?
Can
you
I
produce
just
that?
Yes,
Yeah.
yes.
You see, when Dr. Balivant said it could also be seen in congenital syphilis. Now, as experts, you please decide. 8% have answered that. Because that is also.
Yeah, I think the term blueberry muffin is peculiarly associated with congenital rubella. A similar rash can be seen in syphilis, but that is not termed as blueberry muffin. So when the term here mentions blueberry muffin, it automatically means that it is related to congenital rubella syndrome.
I leave it to you. You are
Yeah.
pediatricians. You take a final call, but I just alerted you. That's all. Okay.
Yes, sir. Yes, sir. Agreed, sir. Agreed. I think the point is that the point was that the question was blueberry muffin, and the blueberry muffin is characteristically seen in rubella.
So it is unambiguous and no issues. Yeah, go ahead.
Yes.
Please continue, Dr. Balivant.
Yeah, so 92% they chosen the correct answer. May know who's the first person who chosen. Yeah, Sonur Prajapat from Rajasthan, Dr. SN Medical College. Congratulations, Dr. Sonu. We can go to the next question. What qualifies as fever or pyrexia of unknown origin? Option A single illness in which fever without a diagnosis after 3 weeks of outpatient evaluation. Option B, 1 week of inpatient evaluation, including laboratory workup. Option C, both A and B. Option D, none of the above. Your time starts now. Answer, please. Yeah, the right answer is the C, both A and B option. May I see the graph?
It's a simple question.
Okay. See, yeah, correct, sir. See, actually, the pyrexia of unknown origin basically classified the child have a fever, 38 degree or 100.4 degree, at least for more than 3 weeks with the 2 visits of outpatient evaluation or 1 week of in-hospital evaluations. So this is a classical descriptions from 1961. And it is available in the Nelson textbook, and they have actually now classified into classical FEO and neutropenic FEO and HIV related FEO and hospital acquired FEO. So this comes under the classical FEO. May you see the graph? So 83% they chosen the option C, which is the right answer. And you may know who's scoring the first. The winner is Ravant Kumar, University College of Medical Sciences, New Delhi. Congratulations, Dr. Ravant. We'll go to the next question. What is the most common malignancy in children? Option A, Wilms tumor. Option B, neuroblastoma. Option C, acute lymphocytic leukemia, ALL. Option D, acute myeloid leukemia, AML. Your time starts now. May I show the right answer? Yeah. Acute lymphoblastic leukemia is the right answer. And most common malignancy in the children, it's a leukemia. If you specifically asked solid tumor, then neuroblastoma can be considered because it is one of the most common extracranial solid tumor in infancy and childhood. Since it's asked the most common malignancy in the children, so the ALL is the clear-cut first answer. And Wilms tumor, kind of a renal tumor, you know well, AML will not come in the choice. May see the graph, please.
Yeah.
And suppose if it is called as an intracranial tumor, what is the most common intracranial tumor? That could be the astrocytoma. And yeah, so 92% they have answered. Correct answer, it is acute lymphocytic leukemia. The winner is Ravant Kumar from New Delhi. Congratulations, Dr. Ravant. Can we go for next question, 7th question? Yeah. Which amongst the following is the commonest cause of community-acquired bacterial pneumonia outside the neonatal period? Option A, Haemophilus influenza. Option B, Staphylococcus aureus. Option C, Streptococcus pyogenes. Option D, Streptococcus pneumonia. Your time starts now. Right answer, please. Yes. Streptococcus pneumonia is the right answer. It is the commonest bacterial infection causing a community-acquired pneumonia beyond the neonatal period. You know well, in the neonatal period, the congenital pneumonia commonly associated with the maternal genital tract and the environment and hospital-acquired infection, predominantly a gram-negative infections contribute much. But once the neonatal period is crossed, then it's the most common bacteria causing a pneumonia is a streptococcal pneumonia. The second most common may be the Haemophilus influenza, but after widespread immunization, that incident is much less now. And the Streptococcus pyogenes unlikely, and the Staphylococcus aureus is still possible, but these are all comes under Streptococcus pneumonia. So the top bug is causing the community-acquired pneumonia is Streptococcal pneumonia. Can I see the graph, please? And the most common viral cause in community-acquired pneumonia is a respiratory syncytial virus. So 80% of candidates correctly answered the streptococcal pneumonia. May I know who's the first candidate fastly answered? Again, Dr. Revant Kumar. Congratulations, Dr. Revant Kumar from New Delhi.
Yeah. Revant is really doing well.
Yeah. And next question, please. Which of the following infections is or highly possible in patients with the splenic microabscesses? Option A, tuberculosis. Option B, melioidosis. Option C, brucellosis. Option D, all of the above. Your time starts now. Right answer, please. All of the above. Splenic microabscesses can seen in tuberculosis, especially the disseminated TB. And melioidosis, it is a very classical finding in a melioidosis caused by Burkholderia pseudomyelli. And brucellosis, in brucellosis also splenic microabscesses has been seen. And primarily, if you see, sometime tuberculosis closely mimic like a melioidosis, but in the tuberculosis, the predominant lesion seen in the liver, and spleen is the secondary. And if you see, calcification changes quite common in a tuberculosis, unlike melioidosis. So it's a melioidosis is a kind of a saprophytic bug. It's commonly available in the soil, water, in all the environment, and it can involve multi-organ involvement. Sometimes its patient can present with the PUO. May I see the graph? Okay.
I think students should know that this is one of these three causes are one of the commonest things we must think about when they have pyrexia of unknown origin.
Yes. Yeah. So now the variable answers. Option D chosen by 44%, and the other options they have clicked. Particularly melioidosis 33% they chosen, but tuberculosis and brucellosis also can cause a splenic microabscesses. So all of them would be the appropriate choice. May know who's answered correctly. Yeah, Jivansha Diwa from University College of Medical Science, New Delhi. Congratulations, Dr. Jivansha. Yeah. Question number 9. What kind of infections are common in children with the chronic granulomatous disease microbiologically? A. Oxidase positive organisms. B. Oxidase negative organisms. C. Catalase positive organisms. D. Catalase positive organisms and mycobacterial infections. Your time starts now. Right answer, please. The right answer is option D, catalase positive organisms and mycobacterial infections. Chronic granulomatous disease, you know well, they actually causes a defect in the NADPH oxidase, and the neutrophil lost the function, and the H2O2 may not affect these bugs, especially the catalase producing organisms. These catalase producing organisms are called Staphylococcus and Serratia, Salmonella, Burkholderia, and fungus like Aspergillus and Candida also comes under the category. And if you see, the reactive oxygen species affects the formation of the peroxynitrate, which is required to detoxify the mycobacterial infections. Since there is a lack of reactive oxygen species, mycobacterial infection also seen in the chronic granulomatous disease. It's a kind of a genetic mutation happens in the subgroup of people. So they present with both the catalase positive organisms and mycobacterial infections. So the correct answer is option D. May you see the graph? Okay, so 80% they have answered option D, which is the correct answer. May I know who scored first? Revant Kumar again. Dr. Revant Kumar, congratulations. We'll go to the next question. Differential diagnosis of a fever with thrombocytopenia in dengue epidemic areas include all except option A, leptospirosis, option B, rickettsial infection, option C, influenza, option D, malaria. Your time starts now. Yeah. Right answer, please. Okay, it's all except, so it is a influenza is the right answer. Fever with the thrombocytopenia can happen in leptospirosis. It is very commonly seen in the rickettsial infections like scrub typhus or Rocky Mountain spotted fever. So they can present with the epidemic typhus, all those things. They present with the thrombocytopenia, and the rashes also will be there. And malaria, both anemia and thrombocytopenia is known to occur. So influenza is the only viral illness that may not cause thrombocytopenia. So the right option is option C, that is influenza. May you see the graph?
Can we have the graph, please?
Yeah. So 70% answered right. The influenza is the except answer. May I know who scored first? So Dr. Anna Sharma, congratulations from UCMC, UCMS, New Delhi. She's the winner. And
thank you, Dr. Balwant. Thank you, Dr. Balwant. I think now we are halfway through. Let's see the scores.
Okay, sir.
Yeah. So can you tell us, the computer G, what is the status at the halfway through?
And also, how many are there
on the platform?
Yeah.
Okay, sir.
Okay. Dr. Revant Kumar scored totally 5 questions correctly, followed by Sonu Prajapat, 2 answers correct. and Dr. Anna Sharma, one answer, and Bhavya Shah and Jivan Shah, one answer. Jivan Shah Dua, one answer each. So Dr. Avant Kumar is leading now, followed by Sonu Prajapat.
Yes, sir. Yeah.
How many are there?
23, I think that's what they projected. Yeah, 23. 23 of them participating.
Can we move ahead, sir?
Yeah. Question number 11. For CSF culture proven gram-negative uncomplicated meningitis, what is the duration of the treatment? Option A, 21 days. Option B, 14 days. Option C, 10 days. Option D, 7 days. Your time starts now. Right answer, please. Yes. See, actually, the CSF culture proven gram-negative meningitis, the antibiotic duration should be 21 days. CNS infections with the gram-positive infections, we will give 14 days. Like streptococcal pneumonia, staphylococcus, we will give 14 days. Gram-negative infections, we usually give 21 days. And 10 days usually comes on the blood culture positive infections, where we give a 10 days duration of treatment, 7 to 10 days, that one. So 21 days is the right answer. That is option A. May I see the graph? And also in the newborn population, the positive blood culture cases, nearly, in the meningitis, 38% of blood culture will be negative. So in the newborn, if you are suspecting clinically meningitis, you have to do the LP and you have to start antibiotic. And 80% they have chosen option A, which is 21 days. That is the right option. May I know who's the top scorer for this? Dr. Mansi Madan from Dr. SN Medical College, Rajasthan. Congratulations, Dr. Mansi. Question number 12. The current recommendation necessitate the addition of a pyridoxine to which subset of children with the TB? Option A, children with the HIV TB only, children with the grade 3 severe acute malnutrition only. Option C, children with the underlying neurological issues only. Option D, all children with the TB. Your time starts now. The right answer, please. Okay. The right answer is option D, all children with the TB. You may see with the previous guidelines, the pyridoxine may not require for all, but it can be added in a HIV or severe malnutrition like a SAM grade 3. But the recent publication from Indian Pediatrics in 2020, so they have said all the children, those taking a INH, the pyridoxine to be included. Because of the peripheral neuropathy caused by the high dose of INH, and also this population is a kind of prone for malnutrition. So adding a pyridoxine in all TB patients now we are doing in children.
May I see have a clarity. See here, the question is, in which subset of children with the tuberculosis? Subset of children. And the answer is all children. So I request the experts to take a view at this question.
Point taken, sir. Point taken. I think the subset should not be.
Yeah. So anyway, we'll see the answer. We'll disqualify, but we'll see. No issue. Because how many have answered others? We'll see. Yeah.
Yeah.
So somebody
Significant proportion. Yeah.
Yeah. So we disqualify this question. I think for not framed correctly. So we will take one extra question at the end. 20 plus one extra question as of now. Over to the quiz master again. Thank you. Thank you.
Thank you. Question 13. Which idiopathic condition presents with the fever, weight loss, night sweats, and is often associated with the lymphadenopathy and hepatosplenomegaly? Option A, Castleman's disease. Option B, Kawasaki disease. Option C, temporal arteritis. Option D, granulomatous with the polyangiitis, GPA. Your time starts now. Right answer, please. Option A, Castleman's disease is the right answer. See, Castleman's disease can produce B symptoms. So what we call it is the fever, weight loss, night sweats. Sometimes you may hear this one from Hodgkin lymphoma and all. And it can produce a lymphadenopathy and hepatosplenomegaly. Kawasaki disease, definitely you know the set of answers. And temporal arteritis will not cause B symptoms with these features. Granulomatous and polyangiitis also unlikely to be answer. So the Castleman disease is the right answer. And also, if you see the Castleman disease, it have a major criteria and a minor criteria. The major criteria is the histopathological examination of the lymph nodes. And the minor criteria, it will come hemoglobin like anemia and elevated CRP and ESR with the hypergamma and hypoalbuminemia with the renal involvement. So the Castleman disease is a kind of a histopathological diagnosis along with the clinical clue. May I see the graph? So 64% answered. May I know who's the top scorer? Congratulations, Dr. Anna Sharma. She's from UCMS, New Delhi. She answered within 2 seconds. Question number 14. Which amongst the following are immunocompromised conditions except? Option A, recurrent multilobar pneumonia, more than 3 episodes. Option B, recurrent urinary tract infection, more than 3 episodes. Option C, single episodes of pneumocystis pneumonia. Option D, single episodes of meningitis with the pneumococcus. Your time starts now. Right answer, please. Option B, recurrent urinary tract infection, more than 3 episodes, is the except answer. So the question is asked, which amongst the following are immunocompromised conditions? So recurrent urinary tract infection is not an immunocompromised condition, you can suspect. And recurrent multilobar pneumonia, more than 3 episodes, you can suspect immunocompromised condition. It's a multilobar pneumonia. Suppose if it is happening in the single lobe, you can suspect aspiration pneumonia, but it's a multilobar pneumonia which is happening repeatedly. You can think about the immunocompromised conditions. And a single episode of pneumocystis pneumonia. Pneumocystis jirovecii is a kind of opportunistic pathogen. So even one episode of pneumocystis pneumonia is documented. You can suspect immunocompromised state in a child. And a single episode of meningitis with the pneumococcus. So in a vaccinated child, if you are seeing a pneumococcus infection, especially causing meningitis, so there should be a breach in protective layers, like some complement deficiency, or the child's spleen may get damaged, so which may cause associated with some other conditions. We have to think about it. So the right answer is recurrent urinary tract infection. May I see the graph, please? 58% answered correctly. Who scored the first? Congratulations, Dr. Mansi Madan. She's from Rajasthan, Dr. SN Medical College. She answered within 1 second. Question number 15. Which set of infections are common in children with the asplenia? Option A, pneumococcal and meningococcal infections. Option B, meningococcal and Haemophilus species. Option C, salmonella and meningococcal infections. Option D, all of the above. Your time starts now. Right answer, please. Okay. So the right answer is D, all of the above. So those children who have a asplenia either in the congenital or after a surgery, so they have a high risk of developing capsulated bacterial infections, encapsulated bacterial infections. So the capsulated organisms are pneumococcus, meningococcus, and Haemophilus influenza, and salmonella also. Salmonella and E. coli also will come under this category. So all of the above is the right choice. May I see the graph? And those children who have a compromised splenic function, we will give specific advice to them. Personal hygiene, they should not get frequent infections, and even prophylaxis with the penicillin is advocated in those children. So those children who had a splenic, sometime a traumatic splenic rupture where we have done a surgery also, we will put the prophylaxis, and we have to give an immunization against these bacterial infections, streptococcal pneumonia with the PCV vaccination and the meningococcus.
Yeah. So here, the immunization is very important for the PG students. That anybody with asplenia or a ruptured spleen getting surgery, or somebody who's scheduled for a surgery, should always have the vaccinations completed at least 1 month before the surgery. And if suppose you do an emergency procedure, then as soon as possible after recovery, we should give the vaccines.
Yes.
Yeah.
Great. So 83% answer. May I know who scored first? Congratulations, Dr. Jivansha Dua. She's from University College of Medical Science, New Delhi. She answered in 1 second. Question number 16. How CNS manifestations occur in leptospirosis? Option A, high burden of spirochetes in the blood. Option B, penetration of spirochetes in the CSF. Option C, immune-mediated mechanisms. Option D, all of the above. Your time starts now. Right answer, please. Yeah. So unlike other infections, the leptospirosis causes CNS manifestation mainly because of the interaction between the host immunity and the bug. So which is called the immune phase. Normally in the immune phase, the children present with the aseptic meningitis like a picture. With the altered level of sensorium, and when you do the CSF, there will be some lymphocytic pleocytosis, but sometimes it's hard to identify the bug in it. So the main mechanism is proposed for a CNS manifestation in the leptospirosis is the immune-mediated mechanism. So the option C is the right answer. And may I see the graph? But option D only 100% they have written, I think. So yeah, correct. For these questions, there is no correct attempt for by anybody. So yeah. Question number 17. A 4-year-old child presents with the prolonged fever, conjunctivitis, strawberry tongue, cracked lips, swollen hands and feet, and a polymorphous rash. What is the most likely diagnosis given these conditions? Findings. Option A, scarlet fever. Option B, Kawasaki disease. Option C, hand, foot, mouth disease. Option D, toxic shock syndrome. Your time starts now. Correct answer, please. Computer. Option B, Kawasaki disease is the right answer. So, Kawasaki disease is a small vessel vasculitis where you can see all the features what it, given in the questions. A child present with the prolonged fever more than 5 days. There will be a conjunctivitis. Conjunctivitis means it's a kind of limbal sparing. The redness seen in the conjunctiva, but it's not involving in the limbus. And strawberry tongue. Strawberry tongue can be seen in group A streptococcal infection, like a scarlet fever also. It is also typical for Kawasaki disease. And cracked lips, kind of oral changes, and red mucous membrane in the mouth. And swollen hands and feet is typically seen in Kawasaki disease, not in the scarlet fever. And a polymorphous rash. In some children, you can see the macular rashes. In some children, papular rashes. Some children, erythema migratum like a rashes. It's a kind of a polycyclic rashes you can see in the body. So kind of it's a polymorphous rashes is a characteristics of Kawasaki disease. But in the scarlet fever, you see the typical sandpaper-like rash. And also in the elbow, you can see the posterior lines. So when comparing these two one, even though scarlet fever is the close differential, but the Kawasaki disease scores the right answer. So the option B, Kawasaki disease is right. Hand, foot, mouth disease usually comes with the bumpy rashes and involving the oral cavity with the oral ulcers. Toxic shock syndrome unlikely for this situation. So the right answer is option B. May I see the graph now? Yeah, 67% they correctly answered option B, Kawasaki disease. May I know who scored first in it? Dr. Sonu Prajapat. Congratulations, doctor. She scored in 1 second. And question number 18. Why daptomycin, a new MRSA antibiotic, is not helpful in MRSA associated pneumonia or MRSA lung abscess? Option A, inactivation by surfactant. Option B, poor penetration inside the lung parenchyma. Option C, penetration in a dead tissue and pus is inferior. Option D, causes reflux life-threatening bronchospasm. Your time starts now. Right answer, please. The right answer is option A, inactivation by surfactant. Actually, daptomycin is one of the newly used antibiotic, a kind of a lipopeptide class. It is commonly used in MRSA, where vancomycin, we are not able to use those conditions. And when we are thinking about the side effect profile of vancomycin, sometimes we use the daptomycin. But what are the causes we should not use when we are suspecting infection in the lungs? So some antibiotic can be inactivated or deactivated by some chemical substance in the particular organ. So one among them is the daptomycin, which is inactivated by the surfactant. And the other mechanism, what they mentioned, like poor penetration to the lung parenchyma, and even in the inside the pus cavity, or the reflex bronchospasm, this and all unlikely with the daptomycin. So the right option is option A. It is inactivated by the surfactant. Can you go for the graph? Yeah, so nearly 50% of audience gone to option A. May I know who's the top
Yeah,
scorer?
I think this is really impressive.
Yeah.
We'll be knowing about it. Yeah.
Yeah, the top scorer is Mansi Madan. She scored in 1 second. She's from Rajasthan, Dr. SN Medical College. Congratulations, Dr. Mansi. Question number 19. Which species of Plasmodium infection do we need to give anti-malarial therapy to prevent a relapse? Option A, Plasmodium falciparum. Option B, Plasmodium vivax. Option C, Plasmodium ovale. Option D, both B and C. Your time starts now. Right answer, please. See, for this question, to prevent the relapse, the antimalarial therapy to be given in the two infections, both Plasmodium vivax and Plasmodium ovale. Actually, if you see both vivax and ovale, they have a potential relapse due to dormant liver stage. We call it a hypnocytes. Erythrocytic stage, the same like a liver stage, we know hepatic stage. So in that, the hypnocytes will be the dormant. If you are not giving antimalarial therapy to eradicate that one, so it can cause a relapse. This is not common in falciparum malaria. Falciparum malaria, the extra, erythrocytic phase, that is called the hepatic phase, is not seen. So these are the two infections commonly live in the liver as a dormant state. If you are not giving any prophylaxis medicine, they can come as a relapse. So the right option, option B and option C included, that is the option D. So the chart wise, 92% they correctly answered. May I know who scored first? Again, Dr. Mansi Madan from Rajasthan. Congratulations, doctor. She scored within 1 second. And question number 20. What is the duration of the treatment for uncomplicated infective endocarditis? Option A, 2 weeks. Option B, 21 days. Option C, minimum 6 weeks. Option D, 3 months to 6 months. Your time starts now.
We should disqualify this there one. Computer G. Take the next question. Sir, you are on mute, sir.
Yeah, that says take the next question. Yeah, next question. Yeah. Oh, so 2 more questions. Will
Yeah,
be
2
added.
more questions have to go. Yeah.
Okay.
Yeah.
Question number 20. A mother brings 28 days old neonate with the rash over the face for 2 weeks. The child has a heart rate of 58 beats per minute. What is the specific antibody for the diagnosis of this condition? Option A, anti-Rho. Option B, anti-dsDNA. Option C, anti-CCP. Option D, anti-topoisomerase. Your time starts now. The right answer, please. So option A, anti-Rho is the right answer. So the clinical description here, a neonate present with the rash over the face for the 2 weeks, meaning with the 2 weeks of life, the child start getting rashes. And the clinical clue here is the child have the baby have a bradycardia. So the heart rate is 58, which is commonly happen in a condition called lupus, neonatal lupus. So sometimes mothers may be positive with the SLE and which can be transmitted to the baby. So they present with the low heart rate and facial rashes. So the investigation of choice, anti-Ro, anti-LA antibodies. So option A is the right choice. So other options are not relevant in this situation. May I see the graph, please? Yeah, 55%. They answered correctly. We'll see who scored the first. Congratulations, Dr. Sonu Prajapat from Rajasthan. Scored in 2 seconds. Congratulations. 21st question. In dengue fever, which normality that we can most commonly observe during CBC?
Drug fever. Drug fever.
I'm sorry. It's a drug fever. Sorry, it's a drug fever. Option A, neutrophilia. Option B, eosinophilia. Option C, eosinopenia. Option D, neutropenia. Your time starts now. Right answer, please. Eosinophilia is the right answer. Usually in the drug-induced fever, for example, commonly what we know is a drug reaction with the eosinophilia with the systemic symptoms. So the children presents with the eosinophilia is a predominant one, which would be the clinching diagnosis when we are seeing they present with the rashes. We don't know whether it's because of the background illness or because of the drug what we have started. And in the dress, sometimes they may have liver involvement and the rashes are very, very characteristic rash. Sometimes it's commonly confusing with the other viral illness as well. So in the drug fever, eosinophilia is the right choice. So the option B is the right one. May I know the graph? Yeah, 75% answered correctly. And who's the first one responded properly? Dr. Jivansha Dua. Congratulations, Dr. Jivansha. She scored in 1 second. Congratulations.
Yeah, one more question to go with. Last question, I think, sir. We are
Yeah.
Computer G, one more question to go.
Two disqualified. Madam, one and
Ma'am, 20 खत्म हो गया. 20 questions were.
I think over.
Over, sir.
20 questions.
Because
20
one question was wrong and another question the computer issues. So
19, sir. Two.
Oh,
one was
the 20th
disqualified, one was. So they have to give one more question.
Oh.
Please give one more question. Correct, Alvasa Sudarshan,
one
sir?
more.
One more should come.
And also, please note one question number 15. None have answered correctly. Oh, yeah.
Okay. Which condition is characterized by recurrent episodes of fever, oral ulcers, genital ulcers, and uveitis, and is of unknown etiology but thought to have an autoimmune component? Option A, Burchard's disease. Option B, Cancrum oris. Option C, Crohn's disease. Option D, Sjogren's syndrome. Your time starts now. The right answer, please. Option A, Burchard disease is the right answer. So the clinical description here, the child present with the recurrent episode of the fever with the oral and the genital ulcers. When you see the oral and the genital ulcer, so Behçet disease would be the one of the differential. And uveitis, so it's one of the autoimmune condition where the iris involved. So the child present with the red eyes as well. And if you see other condition very close to this diagnosis is the Crohn's disease. Crohn's disease can present with the oral ulcers. Even some case reports are there for the genital ulcers. Uveitis also can be seen, but if you see the predominant lesion in the Crohn's disease is the scleritis, episcleritis, not uveitis. So the Behçet present with the typical uveitis, and oral and genital ulcer is very common. Crohn's disease, abdominal symptoms are more common. Intestinal manifestation is more common. Extraintestinal manifestation is very less. But Behçet disease is the multi-system disease where it involves mucus and eyes, and they present with the recurrent ulcers in the mouth and genital regions. So the right choice is the Behçet disease, option A.
Graph.
Oh, 90% they scored, they chose the first answer, option A.
Winner.
Yeah, Dr. Revant Kumar. Dr. Revant Kumar from New Delhi, he answered correctly. So option A is the right choice. Congratulations, Dr. Revant.
I think we complete the quiz, and I think Dr. Jagdish Chinnappa, I think should take over and move further. Yes, please. Yeah.
Thank you, sir. I think it was very well conducted, Dr. Baliwant.
Thank you,
sir. Well done. And even all the participants also have done a wonderful job. Thank you, Dr. Rashna, for joining in also. So, Dr. Revant, so now we have a tie between Mansi Madan and Sonu Prajapat. So I think we should have a tiebreaker.
Yes, sir.
So
only
now the
for
rules
them,
are,
no, sir?
Yeah. So the rules are very simple. Only
I have
Dr.
one,
Mansi.
I have one. I want one clarification. Can you please put that
graph
list? See, there were 20 questions. Okay. Am I correct? There were 20 questions. And for one question, there was no correct answer.
Correct, sir.
So then how many correct answers have to be there? No, I may be wrong. Just please put that this one. Yeah, list with scores, list of students with scores. No, it is for the benefit of everybody, particularly for me. I normally get doubts like this. Can you put that list of students with scores? In my opinion, it should score to correct answer should count to 19, because for one question, none answered correctly. Now, yeah. See, yeah. So there was some change. Yeah, just. Yeah. Yeah. Can somebody clarify, am I thinking wrongly? Because I am not good at mathematics. There were 20 questions overall. And for 19, there were correct answers. Okay, for one, there was no correct answer. So it means none answered correctly means one question was not answered. So the total should come to 19 is my poor sense. I'll be happy if I am proved wrong.
So one question went unattempted, so we haven't counted that.
Not like that, yeah. What sir is telling is, you had 23 questions which was told, right? Then in that one, nobody answered it correctly, it comes to 0. That means only, and 2 were disqualified or for reason. So 3 went away.
So 20 left now.
Ma'am, that could be some questions where more than one doctor answered correct.
But only one winner.
Yeah.
Only one winner. Only one winner. Anyway, see, can I repeat what I have in my mind? See, ultimately, we have made correction for the 2 questions which were disqualified.
Can we get the list of all 23 answers list? Can we have it?
Yes.
From starting question number 1 to question 23? Can we the one disqualified, put it as disqualified, one unanswered, put it as unanswered, one all those. Actually, I have written down, I can tell, but let the computer tell.
I think actual number will be more. Yeah.
Because I have written down which question
No,
who
I
answered
think
everything.
I think Dr. Sudarshan has a very valid point. There should be 19 correct answers.
Correct. So let them put all the 23. I want all the 23. Please display all 23.
No, also as Praveen says, one extra question was also added because of the wrong question.
No.
No, Praveen is wrong. No.
I'll keep quiet. I have raised a point because I was waiting to count 19. So it came
Exactly,
20.
sir. Exactly.
Yeah.
One question was, yeah. Let's see. Let us see.
So there were 22, correct, sir? 22 questions that were asked. Anyway, let them show.
I think Dr. Manjula.
Yeah.
There were initially 20 questions.
Plus
one
one
question. One question was disallowed by Dr. Sudarshan. Another question was mistaken by Computer G. So therefore, there were 18 questions. Out of the 18 questions, 2 additional questions were given. So total number of questions was 20. Out of the 20, 1 question was not answered correctly by any participant. So therefore, total correct answer should be 19. So if there are totally 19 correct answers, we should have 19 count in that list.
Yes. That's why I am sitting here 4 days, 4th day, 3 hours simply listening to pediatrics and medicine. Huh?
Sir, you
Please
can
show the entire list.
Sir, Dr. Sudarshan, you can appear for ECFMG now. Dr. Rashna is looking very glum. Why? What happened, Dr. Rashna?
I know.
I'm so bored
she was
waiting
in
for
between.
NMC.
She was not there. So she will
No,
not.
I'm waiting and waiting for NMC from 12:30. They're making us wait. I'm so bored. I missed the quiz also. See?
Dr. Baliwant is extra happy because he could conduct the quiz.
No, he conducted it very well.
Yeah. No, there's no issue. Yeah. Now, 1 minute. Yeah, now let's. So question number 12 was disqualified. Okay. That is with subset children, there was no subset and it was disqualified. And 16, no correct attempt. Okay. And question number, this is computer G error. 20 disqualified. Okay. Then 1, 2, 3. 3 added. 1 minute. No, 1, no correct attempt. So no correct attempt. Time taken. So no time taken. It is not time
3 questions
taken.
were added, sir.
Sir, time taken by the participants, sir.
Okay.
No, it's 3 questions were
3
added.
questions added.
Yeah.
2 error and 1 no correct answers. Therefore, 20.
Yeah. So 23, 20 questions were asked. For one question, nobody answered correctly. So that becomes 0. So 19 correct answers must be there.
Sir, what
there
they're
are totally
telling is that
23
23 questions were asked. That is why one additional question have been asked. That is why one additional answer is coming.
That is why one additional.
Oh, means for that no correct
wrong
attempt
and one
also
no
one extra question has been asked.
Yes.
Yeah,
It's
three
what I'm
questions
telling.
are
That
asked.
have been asked.
Mm.
They failed. Is it not?
Mm.
Anyway, okay, we'll give that benefit to the participants. No
Yeah.
issue. They got a benefit of an extra question. No problem. We will go. I think we will not drag on with this.
So now we have to go for the tiebreaker, sir.
Tiebreaker. Can we see? Just see that. 4 and 4. There are 2 students. So we have to break the tie. 3 questions. You have announced it as tiebreaker is 3 questions.
Yeah. Computer G, please, you have to correct your PPT and make 3 tiebreaker questions.
No,
one after another. Yeah.
Madam, 1 minute. I think Dr. Jagdish Sinappa and also our Dr. Baliwant. See, there have been some errors from our side. Okay, man or machine error has happened. Okay, so we need to go slow. 3 questions. That is for tiebreaker. Only those 2 students need to be there. That is so. We'll give some time for computer G. Only those 2 students, and the rest all have to leave. And I think rest. I think it is over to Dr. Jagdish Chinappa and Dr. Baliwant. Dr. Manjula, please. Yeah.
Atharva, you should be on mute, please. Atharva, please mute.
I will mute. There is nobody in my room.
Yeah. Uma or Neelam who are there, kindly take 3 questions from the tiebreaker round and then. Because first 3, I think.
The first candidate from UCMS, because there were so many, that one I don't remember the name. I think it will be there. So now I think to
Can we share a technical question?
3 question has to come, 3. And plus, in case there is an additional tie break, be ready with the other 2 questions also.
Yes.
Okay.
Okay, yeah.
So the tiebreaker, question number 1. Children aged less than 1 year with the first attack of UTI should be investigated with A. Ultrasonogram abdomen, B. Ultrasonogram abdomen DMSA scan, C. Ultrasonogram abdomen MCU, D. Ultrasonogram abdomen MCU and DMSA scan. Your time starts now. The right answer, please. Option D. Ultrasonogram abdomen, MCU and DMSA scan is the right answer. So infant presented with the first time culture proven UTI, mainly we have to rule out is there any congenital anomalies in the urinary tract, cockroach. So for that we need to investigate significantly. This question is actually based on the guideline. So some question can be taken directly from the guideline, so it's easy to answer. So the option D is the right answer.
Sudarshan sir, we have to consider only Mansi Madan and Sonu Prajapat, sir, right, sir?
Correct.
Right.
Only those 2. I don't remember the names. Yeah. Only 2.
Yeah.
Okay.
Yeah.
Can we see?
Dr. Sonu Prajapat answered in 1 second. Congratulations, doctor.
Okay, next one.
Question number 2. The set point in the anterior hypothalamus will set at a higher point by the action of option A, interleukin 1-6, TNF alpha, and prostaglandin E2. Option B, cortisol. Option C, epinephrine, norepinephrine. Option D, all of the above. Your time starts now. Right answer, please. Option A, interleukin 1-6, TNF alpha, and prostaglandin E2 is the right answer. This question can be easily answered if you know what is the mechanism of fever. So when the bug enter into our body, so these chemical mediators are released. So these are the reason why we are getting fever. So they usually increase the set point of the anterior hypothalamus from 98 degree to, for example, 101 or 102, where the body feels hypothermic when compared to the brain set point. So it started increasing the body temperature by shivering the muscle and other environmental stimulus for us. So option A is interleukins and TNF and prostaglandin E2 is the right answer. May so the see the graph, please.
Right.
No, correct. Okay.
So last tiebreaker, sir. Last tiebreaker.
Last. Yeah, we'll see. If it is answered by the other candidate.
Question 3.
Again.
Which of the following
We don't
occurs
need
by...
another tiebreaker, ma'am.
Sir, can I read?
Yes, sir. Please go ahead, sir.
Which of the following occurs by airborne transmission? Option A, tuberculosis. Option B, varicella. Option C, measles. Option D, all of the above. Your time starts now. Right answer, please. All of the above is the right answer. Sometimes it's it's a testing question. We may think varicella may not spread through airborne, but varicella is the airborne disease only. Even like a measles. Measles also comes with the respiratory prodrome, but varicella is a very minimal only. Tuberculosis definitely we know well. So sometimes we may get confused, but it's all of the above. Tuberculosis, varicella, measles, all transmitted through airborne disease. So may I see the graph, please?
Yeah, hopefully no tie, sir.
One previous. It has to be another name this time.
Dr. Sonu Prajapat scored the first mark here. Congratulations, Dr. Sonu. She answered in the 1 second.
What was the previous name? Yeah.
Previous was Mansi, Dr. Mansi Madan, sir.
Yeah, so only two were there. Mansi and Sonu, one each.
No, sir. Previous also Dr. Sonu. First
Is
one
it?
also Dr. Sonu.
Then it is over.
Yeah.
Two and one no right answer. Four.
So they will have to show the score again, sir?
Yeah. So let them show.
Okay.
Let them show of this tiebreaker event.
Can you show the three questions which you played as tiebreaker all together?
Yeah, let them take time.
Yeah.
And they got a benefit of one extra question also. This was a game. Right. Okay.
Correct, sir.
Okay. Now the main event.
Everybody got.
Everybody got. Right. No, they need a minute. I have no issue from my side.
Right, sir. So, Jagdish sir, you want to say something, sir?
I think it's we are very happy with the very fair conduct.
Dr. Balivan sir, what do you say overall?
Overall, it's a nice arrangement. Actually, first I have to appreciate you. So, and the
Students were also very competitive today.
yeah,
right, sir?
yeah. So they have within 1 second answering and all.
Yeah.
I think many questions they are thinking like a spotters. By seeing one, immediately they answer.
Actually speaking,
I think we should now start putting the computer G into that 1 second bracket. Computer G is taking time.
Yeah. Sudarshan sir, your views overall.
Nice. ने दो टाइप ब्रेकर दिए तब वो जाके 6 पे पहुंचा है.
Atharva, please mute. Atharva, please mute.
No, I enjoyed this particular session because it has come with some nuts. Otherwise, it was all plain, bland, monotonous, smooth, all well, routine stuff. So here there was some something different happened, and we have been kept busy. One by computer, of course, another.
So next time, Dr. Manjula,
Yes, sir.
Dr. Manjula, we should purposely create some 2-3 mistakes.
For make sir too.
Yeah, Sonu Prajapat is the winner in the tiebreaker. Correct.
Can you please correct the spelling of breaker?
Yeah, no, that.
And font size of Sonu Prajapat?
Okay. Good.
Congratulations, winners.
Yeah.
Congratulations, winners.
Yeah.
Congratulations to all the participants.
SN Medical College is in Ajmer, if I am correct. Yeah, it is
Jaipur, sir.
I have got that.
Jaipur, sir.
No. Just check.
SNS Jaipur, sir.
No, it is SMS. SN Medical College.
I see. Okay.
That is SMS. I have gone long back, 30 years back. I think I have gone.
Right.
Medical College, Ajmer. SN Medical College, Ajmer. Somebody, anyway, we can check it in Google anyway. So, madam, I think Dr. Jagdish Chinnappa or all of you have to conclude from my side. It is over. Done. Thank you, everybody.
Thank you, sir.
Thank you. I congratulate the winners, and our Fever Foundation team will contact you and tell you the detail. You are both of you are eligible to come for final, which is going to happen in FEFCON. You are eligible to participate in the national final. So be ready, and then it will be in November. So Dr. Revant Kumar and Dr. Sonu Prajapat, our Fever Foundation team will give you all the details about all this. And I also congratulate all the participants. I also would like to tell that all of you are going to get participation certificate having participated in this quiz program. And second is we have the poster presentation competition coming up. The last date to submit your poster is September 10th. Kindly submit your poster. The details will be shared at your HODs and also at your notice boards. And also we have your email IDs. We can share you all the details as well. So thank you very much. I take this opportunity to congratulate Dr. Jagdish Channappa sir for having supported all the 4 days and helped as a quiz host and done the extremely. So we are done with the pediatricians quiz. All the 4 zones are over. So now we will be going for thing. And I know you're so busy. Even last minute request also you accepted and came. Thank you so much, sir. Dr. Balivan sir, again, yours was also last minute request. Wonderful, sir. You took so much effort in going through everything, discussing, and thank you so much. It was wonderful to have you. And it was also not only game for children, for the postgraduates, you also made it very, very kind of informative as well. They learned a lot during quiz program. Thank you so much, sir, for accepting. Dr. Sudarshan, sir, thank you very much. One more to go, sir, for you.
Yeah,
and
yeah.
thank you so much for
It's seven.
patiently helping us. So thank you so much.
Thank you,
And
thank you.
really good. And
Sudarshan sir,
thank you.
SN Medical College is in Jodhpur.
Yeah, I checked it. Jodhpur. I checked it.
I mean, video is not disabled.
Yeah.
Okay, sir. Thank
Yeah,
you very
yeah.
much. Thank you all for
Thank you.
everybody.
Thank you.
Yes, sir.
And
Yes,
thank
sir.
you, students, for being
Thank you,
here.
sir.
Thank you very much.
Praveen, you would like to say anything before we close?
I think last 4 days of pediatric quiz was fantastic, and the kind of the students, the way they were answering, as we are seeing, most of the correct answers are 1 second answer. I am sure the rest are 2 seconds or 3 seconds. The students are answering. That is something which is shows the level of the kind of knowledge that the new generation of doctors are having, and we are very proud that as from Fever Foundation we have been able to connect with this new generation of doctors. And Dr. Balivan sir, thank you so much for having accepted and been here. And Sudarshan sir, as you you have been
always supportive
backbone and the jury. And Jagdish sir, well, this is incomplete without Jagdish sir. Thank you, sir. Thank you very much.
Thank you
And
very much, sir.
Thank you, sir.
Namaste,
Thank you very
sir.
much.
Thank you. And namaste to all of you, sir.
Thank you.
So Krishna has recovered, huh?
Yes, sir. Can you stop recording, please?
Yeah.
Are we live? Okay. Yes, sir. Yesterday night